Hi everybody, welcome to week 12, even though we're already halfway through it. Sorry about that. This is my lovely splint and dressing from the surgery. Anyway, recovering pretty well, still doing mostly one-handed typing. Oh well. All right, so this week we're talking about teaching being a collaborative discipline. And, there's all types of ways we can do that between disciplines, between teachers, sharing teaching strategies, sharing content, sharing resources. One thing I want to touch on, though, is team teaching. And I don't know how much you have experienced that. So there were two places that did different types of team teaching. In a BSM program, it was true team teaching, one course, and usually there were 3 instructors. And so we usually taught like med-surg, advanced med-surg, that sort of thing. And basically the 3 of us would divide up the different days of teaching, divide up the content. We would all write test questions. We would all review each other's test questions. We would all evaluate the tests together. So it was definitely a team approach. And it was very interesting. Students could come to any of us with questions. They might like one teaching style better than the other. We all kind of had different approaches to education. So some of the negatives were you had to really count on other people to pull their weight. When I'm managing my own course, I just have to worry about me, right? I'm totally responsible, but you have to kind of count on other people doing what they need to do for the success of the students. It's a little different when the faculty are at different levels as far as knowing the content, teaching, writing test questions, things like that. So that can be a little difficult. But some of the pros are that we can really draw on everybody's different areas of expertise, which is really helpful. And the students do get things presented in different ways. So they get exposed to different strategies. And we do kind of push each other to be more creative, more approachable, more student-centered. So that was definitely a positive. And so it was really interesting. Another way that sometimes team teaching occurs in academia, not true team teaching, but maybe you have multiple sections of the same course, foundations, med-surg, that sort of thing. And you have so maybe you have 3 sections of med-surg and 3 different instructors teaching theory and the 3 different sections. So in when I did it that way, we had one team leader, and that person was really responsible for like the test questions, evaluating the exam, and but everybody was responsible for their own teaching. So that had its pros and cons too. So basically, I just want to let you know that team teaching, collaborating, can look different depending on where you're at. For instance, you might, in the clinical setting, have a new residency orientation, and maybe the different unit-based educators will divide up the different portions of that. And again, there are pros and cons, continuity versus teaching on area of expertise. So different things like that. The thing I really want to make sure that you take away is that collaboration is wonderful when it comes to education. And collaboration outside the discipline also can be very helpful with respiratory therapists, physical therapists, occupational therapists, getting their take on different aspects of the areas that you're dealing with. In the clinical setting, you might do some collaboration with, for instance, the quality people. What trends are they seeing that you need to address in their teaching? Maybe folks that deal with patient satisfaction. How does that tie in with your teaching? So there's a lot of collaboration that goes on, but if you're not careful, teaching can be somewhat isolating, because when you're actually doing the teaching, typically it's just you and your students, nurses, whoever your participants are. And when you're creating your own content, a lot of times it's just you. So I do really encourage you. One of our previous competencies talked about socialization to the role. And I do encourage you to get to know your fellow educators, people in other roles that maybe do education. One time when I was teaching at a community college, we had a teaching circle where a bunch of the educators in the nursing area came together almost like for book club once a month, and we would read a chapter of a book about teaching, and we would discuss it throughout once a month, each month. So that was kind of interesting. So a lot of ways that you can collaborate, but it does, I think, take a conscious effort because educators are always so busy. All right, so I think those are my thoughts for this week. Any PD is due again. If you're getting close to the end of your hours, just look at the what I wrote for the last NEPD about what you should submit this time. If you have any questions, please let me know. I hope that you guys are moving forward with your portfolios and have kind of started to work on those. I just want to keep stressing the big point with the portfolio is it's not about what you think you're going to do or might have an opportunity to do. It's all about what you have accomplished so far. And those accomplishments can either be during your practicum or in any other work setting that you've had. So that broadens up a little bit and I think makes it a little easier to put together that portfolio. Okay, everybody. I think that's about it for this week. And hope you have a great time with the rest of the few days talking to each other the course, and I'll be back next Thursday. See you in the main forum.